All right, well, good morning, everyone. First of all, let me thank you all for being here this morning. I want to thank everybody for hosting us this morning and hope everybody had a safe, happy holiday weekend. I also want to thank Dr. Toomey and Commissioner Berry for joining us today, and certainly the whole team here at Pruitt Health for hosting this press conference. Also, just wanted to recognize Senator Butch Miller and Representative Matt Dubnick. Certainly appreciate their strong leadership here in the Hall County area, and just two great friends of mine, and really appreciate all the support that they have given us through this public health state of emergency. I think a lot of people take for granted that that's never been done before that I know of in the state. Took legislative action, and I think those actions have certainly been warranted, but I want to thank those guys for their continued strong support. 2 weeks ago, we watched hope arrive here in the state of Georgia as the COVID-19 vaccine began rolling out throughout the Peach State, and since then we've been vaccinating the vaccinators in every corner of our state as frontline healthcare heroes in hospitals and public health facilities rolled up their sleeves for the initial doses of both the Pfizer and Moderna vaccines. I also want to again thank President Trump, the Trump administration, Operation Warp Speed, all of those individuals in the public sector and private sector who have made this vaccine possible. I don't think people really realize the medical miracle that we are experiencing right now, so I want to again thank them. Today we also begin another exciting and important chapter in the administration of COVID-19 vaccine here in Georgia. Across the country, no group has been hit harder by the virus than the residents and staff of our long-term care facilities. And for months, we have used the full weight of state government with support from our federal partners to ensure that these facilities had the resources necessary to fight COVID-19 head-on. Our Georgia National Guardsmen served as a model for the rest of the country. I know that seems like a long time ago when that started, but it is amazing what they did, completing thousands of infection control missions in literally every community in Georgia to ensure that these care centers met strict guidelines to help keep the virus at bay. The men and women of the Georgia State Patrol made urgent deliveries of critical supplies to keep residents and staff healthy. And to meet the increased need for testing, the state has spent now $78 million in coronavirus relief funds to support COVID-19 testing in nursing homes throughout our state. These measures have been the result of an unprecedented partnership between the federal government, local leaders, and our partners in the private sector. And today we're proud to be here in Gainesville as the next step of that partnership gets underway here in Georgia. As another testament to the strength of the public-private partnership in fighting COVID-19, the federal government and the team at Operation Warp Speed have rolled out a program for long-term care facilities to partner directly with CVS and Walgreens to deliver the vaccine to their residents and staff. Dr. Toomey and Commissioner Berry can speak more to the specifics, but I can tell you that more than 95% of our facilities across the Peach State have already enrolled in this program. And we are eager to see the vaccine make its way quickly and safely to our most vulnerable and to those great Georgians who are giving them world-class care. Right here at this facility, Pruitt Health is already lining up its caregivers to receive the vaccine. Among them is Jonathan Harris, a senior certified nurse assistant for Pruitt. He was selected to be the very first Pruitt healthcare giver vaccinated in Georgia. Jonathan, we're excited for you and for all of your nursing home staff today. I want to thank you for your willingness to step up and be number one. It says a lot about your commitment to your patients and to your profession. Staff, as you know, in our long-term care facilities have been the frontline heroes for months now, and we could not be more grateful for their work and for leading by example of getting the vaccine. I've also been told that to celebrate their caregivers, Pruitt Health is joining with Waffle House, another great Georgia company, to buy all vaccinated Pruitt Health staff breakfast. Whatever it takes to get them to take the vaccine. Each frontline worker who is vaccinated will receive a Waffle House gift card, and if that doesn't get you in line, I don't know what will. In a moment, I'm going to turn it over to Dr. Toomey and Commissioner Berry to give more details on where we are on the distribution of the vaccine. But first, I want to ensure all Georgians that we are working diligently to get the vaccine out and following the direction from CDC. In the meantime, though, we still need every Georgian to do their part to stop the spread of the virus as we face the new year and the rest of the winter season. Though the news of the vaccine is encouraging, right down the street at Northeast Georgia Health System, they are seeing the highest COVID patient volumes yet and the largest number of patients in any hospital anywhere in our state. Last week, their message was loud and clear, and I'm here to echo it once again. COVID-19 is still here, and it still presents a threat to the people of our great state. On the state side, we continue to work around the clock to stand up the temporary facility at the Georgia World Congress Center. That facility should start accepting patients by the end of this week and will be a big help to alleviate pressure on our area hospitals and statewide hospitals and ensure that they have the capacity to continue caring for their patients. And as I mentioned last week, by December the 30th, we will have an 80-day supply of all critical PPE supplies ready to deploy at a moment's notice. That said, we know the best way to mitigate the spread of the virus is through our own personal actions. Over the last 30 days, the highest percentage of new cases has come from individuals that are between 18 and 29 years of age. And while death in this category are thankfully very low, these individuals can bring the virus home with them during the holidays to their parents, grandparents, and others who are more vulnerable. That is why, with New Year's Eve this Thursday, I'm again making the same plea I made last week to the people of our state. Limit your gatherings to small groups of people within the same household. Consider gathering virtually to watch the ball drop. Consider the risks of including elderly loved ones or those more susceptible to the virus, and implement the best practices and public health guidance outlined in our orders into your plans. As I've said several times in recent weeks, the guidance in our executive order has been the same for months now, including limits on bar capacity and gatherings over 50 people, and can be enforced by any state or local law enforcement agency. And I know that they do not want to have to do that. So I'm encouraging everyone to help be part of the solution, not part of the problem. And I would ask all Georgians to take that into consideration as we look to the New Year's Eve and New Year in just a few days. We also need people to continue to follow the 4 things that we've been talking about to limit the spread of the virus, regardless of your New Year's plans. Wear your mask, wash your hands, practice social distancing, and continue to follow the guidance in our public health executive orders. While we wait for the vaccine to be available to the general public, which we do not anticipate for a few months, we can all do our part to slow the spread by making wise decisions and acting in the best interests of your fellow Georgians. Together we can ensure that Georgia continues to weather this storm and emerges stronger, safer, and healthier than ever before. Thank you so much for being here, and with that, I'm going to turn it over to Dr. Toomey to make some remarks to you.
Thank you so much. It's a pleasure to be here, and special thanks to Pruitt for hosting us here and for being the first to roll out this extraordinary partnership that is really going to save lives. I'm going to give you a shocking statistic. long-term care facility staff and residents represent about 5% of our cases in the state of Georgia, and yet represent over 37% of the deaths in the state that we have reported since this pandemic began. We hope with these vaccines we will begin to change those statistics and save lives here, not just in this long-term care facility, but in all of those that are participating with us in this vaccine program. As the governor pointed out, 95% are working together with either CVS, who's here today, or with the Walgreens throughout the state to be able to ensure the residents and providers are covered. It's very important that the providers as well get their vaccinations during this time. And our health departments will work together with those 5% that aren't part of this partnership. So we are really very pleased to roll out this public-private partnership that will utilize our vaccine allocation, but basically be an assist to us to be able to do this faster and more efficiently and reach those most vulnerable in our state. We've already today received additional allocations of Pfizer and are expecting Moderna vaccine as well. And so we are really working to ramp up our vaccine distribution throughout the state in this coming week. And I really want to give a shout out to the many hospitals as well as our own public health departments that worked throughout the Christmas weekend to vaccinate the vaccinators and other medical care providers, including dentists and others who would not otherwise have access to the vaccine. And so we are pleased that this is continuing, and we are getting a great deal of support for this. I want to also say that for those who are hesitant about the vaccine, the data look wonderful. The data from the vaccine look very, very good, and the safety record is very, very good. And so for those of you who still have some, whether it's healthcare workers here in the long-term care facilities or in the hospitals, or those of you in the community, as we begin to roll out our vaccines into other older adults and essential workers, you should be reassured that these vaccines are safe, effective, and will save lives. And so we really strongly encourage you to be vaccinated when we reach that phase of the vaccine process. We're following CDC guidelines, and we'll be rolling out, we suspect, into the next phase by the end of this month, if not even sooner. I also wanted to announce today that we have a special call center for the public, because we've gotten so many calls from the public about where can I get a vaccine, is this vaccine safe, what is the information, what's the difference between Pfizer and Moderna, does it make a difference, can I choose when I go to a place to be vaccinated? And so we've enlisted the Georgia Poison Center, who has worked with us for many years on outbreaks and other notifiable diseases, and has also been providing information to the public about just COVID disease. They will now be also providing information to the public. There's a 1-888 number that's listed on our website, 1-888-357-0169 will be the number available to the public. Look at it, it's on our website, but call that number if you have any questions about the vaccine, your eligibility, when your particular group or age group or occupation will be the focus of the vaccine efforts, because they will be able to help as well. And last but not least, I want to say that we already have enrolled 914 providers. That's so literally every day, more providers are enrolling, so we can ensure that as we continue to roll out the vaccine throughout the state, as more vaccine becomes available and we get our vaccine shipments week after week and move from phase to phase, that there will be providers in all of your neighborhoods that will be able to make this vaccine available. And so, as the governor said, it's so important we continue to follow those four things for winter, those four prevention efforts, but I'd like to add that fifth. And when it's your time to be vaccinated, please get vaccinated for COVID. That's our one most important resource we have, that we can truly stop this epidemic, so that next year at Christmas time, we'll be able to follow a different kind of trajectory for the state. So thank you so much, and thank you for being here. And let me turn it over to my friend and colleague, Commissioner Frank Berry.
Good morning. Thank you, Dr. Toomey and Governor Kemp, for your leadership during this crisis. It's been remarkable. Thank you both. Thank you to all of our frontline healthcare workers. A lot of times we talk about hospital workers, but our long-term care facility staff have been equally engaged in this battle, and thank you very much for your service to Georgians. Over the pandemic for the last close to 10 months, the state has helped with staff augmentation. Many of our nursing homes and long-term care facilities were bombarded with the COVID-19 illness, and it impacted staff as well. So staff augmentation played a critical role in keeping these facilities open. Temporary nurse aides have been deployed and have been a remarkable asset to helping combat the illness as well. Grants were awarded for communicative devices that helped with isolation. Many people were unable to have communication with their loved ones, and iPads and cell phones were offered through grant initiatives that allowed for them to have contact with family members. PPE has been awarded across the state under Governor Kemp's leadership, so that nobody could say that they did not have appropriate PPE. And finally, over 3,000 surveys were conducted during the last 10 months to long-term care facilities, sending state employees out into harm's way who were committed to doing those surveys work. Finally, I wanted to say that today is a great day. It's a day of hope, as the governor said. We feel like we're now getting involved in the offensive instead of the defensive, and that's a great day for us. And again, I want to recognize Dr. Toomey and Governor Kemp for their leadership and for providing all of the resources that we've needed, and continue to ask the question, what else can we be doing to help secure a safer environment for all of us? Thank you very much, and I can answer any questions that anybody may have. Thank you.
We want to do the vaccine. We're going to do it themselves. All right, good deal. Anybody got any questions for Commissioner Berry, myself, or Dr. Toomey this morning?
Yeah, Governor, do you have some specific numbers about how many doses have been administered, and then specific timing on when patients in nursing homes will start to get the shot into the arm, not just staff here?
I may let Frank or Dr. Toomey answer that. They probably have better information than I do.
Sure. I just wrote this out this morning. Our allocations of Moderna are 234,000. Our allocations of Pfizer are 268,125. I was told we just got a shipment in this morning, and those will be going to providers all over the state. And we anticipate, that there's 39,000 doses of the Pfizer that will have been deployed to long-term care facilities through this partnership. And so if you think about it, the providers here at the long-term care facility are the firewall protecting the residents. And so they will be vaccinated first. And then after the staff are vaccinated, then the workers or the residents will be vaccinated. So that's it's a very strategic way to work. If you're actually protecting the residents by vaccinating the staff and doing that very, very quickly. And I think I answered your question.
Do you know how many of the allocation have been administered so far?
Okay, there's a website. I don't know if you've seen it. It's on our website. It's usually about a day behind because there's been vaccinations over the weekend, but it's still saying 26,000, and I know we've done more than that. And so because that's what's entered into the GRITS, the immunization registry, And so if you look later today, it'll be updated with the most recent updates. And just know that there's a bit of a lag between the actual administration of the vaccine and then the reporting into GRIDS. But the website is a good way to keep track of that every day.
And let me just add one thing, Dr. Timmy. On the numbers, I think just like today, starting in nursing homes, this is going to ramp up. It'll, always the first few days it takes a while to get everything going. But really, for the last 2 weeks, the vaccine's been given out. I talked to, I think it was 11 hospital CEOs all across the state when I was driving home. I guess it was 2 days before Christmas. And you could literally tell the excitement in their voices because they were all given the vaccine. They had all gotten it. Some, it took a little longer than others, but they all had places set up in their facilities. They had people rolling through there. When we were with John Lewin at Emory the other day, he said they have the ability eventually to do 4,000 vaccinations a day if they can get them. So I can promise you, CVS, Walgreens, the nursing homes in our state, they are ready. We just got to get the ball rolling, which it is starting today. But in our hospitals, I think that's going very smoothly from what I've been hearing.
This is going to be for all of you. I was hoping you might be able to speak to just a logistical challenge, obviously, of getting these vaccines to care homes that literally are in every town across the state. And then secondarily, the 95% number who are enrolled, does that 95% number also include very small personal care homes that maybe aren't under DCH authority, but are under 25 beds?
I may let Frank or Dr. Toomey speak to the last point. I would say logistically, again, thank you to the Trump administration, Operation Warp Speed, the public-private partnership with CVS and Walgreens just to go straight to the facilities like here at Pruitt and take the states out of being the middleman. Obviously, the doses are coming out of our allotment, but to me, that makes a lot of sense that they're working on the logistics of that. So I feel like that's going to go very well because you're going to a specific location. They know how many staff, how many residents, so you know how many vaccines to ship. You can be very efficient in the way of doing that. The challenge, I think, for us, and I'm just speaking for myself, I'll let Dr. Toomey or Frank weigh in on this if they would like, but when we get to the general public, that's when you have even more of a logistical challenge, which is but there's good things that are happening, and we're continuing to work on that every day. Like Dr. Toomey said, we have, 900 providers that have now signed up. We've got our local pharmacists. We've got, our public health departments all over the state, every county in the state. So we're going to gear that up and get this vaccine out to people, whatever it takes. We will deploy whatever resource that we need to. And then y'all feel free to.
I can say a few words, and then Commissioner Berry. The benefit of this partnership with Operation Warp Speed is that they actually ship directly. Although we have some vaccine shipped to our warehouse so we can keep it for emergency purposes when there's a need at a hospital that finds that may need additional doses or other providers. We're trying to reach all those providers who aren't reached by hospitals through our public health departments. And I mentioned that we've vaccinated hundreds of such providers, including primary care physicians, dentists, and others in the community. And as the governor said, I just wanted to comment again, it's just amazing to see people's faces and excitement, tears of joy, literally, in the waiting room of providers who have been working at this for so many months, and now seeing that there's an end in sight, a ray of hope that is going to protect them and their families because they've had to worry about that. So the logistics are difficult because of the cold storage issue, and so you have to match the provider with the right vaccine. But once we direct where they go, it's shipped kind of automatically through the process, and it's working very well and be shipped directly to these long-term care facilities. We anticipate that the personal care homes will be vaccinated by our public health departments, and they will be working directly with our public health county and district health directors, and so we'll be continuing to roll that out, and that's part of their work in the community.
No, that covered it. Thank you.
Everybody that's freezing to death in the back, please feel free to move to the sunshine if you won't bother us at all.
Governor, one last question. Obviously, today is a very exciting day, right? It's a great day. But we've also heard from folks that once you get the vaccine, you still should be wearing your mask. Can you just, again, speak to the fact that even though today is a great day, it's not a day to let up on what we've been doing for so many months?
Oh, no, absolutely. You know, we've got to continue to use best practices. Obviously, this is a dual dose vaccine. So, you know, I'll let Dr. Toomey speak to more of the specifics of that, but we cannot let our guard down. We've got to continue to do those 4 things, or 5 now, with wearing your mask, practice social distancing, wash your hands, follow the guidance, and get the vaccine when it becomes ready. That's what I'm going to do when I become eligible as well. Dr. Toomey, did you want to add anything?
No, it's very important that, remember that until everybody, as many people as possibly can be vaccinated, and so we're hoping at least 70 or 80% are vaccinated, we won't have the kind of immunity in the community that we will need to ensure protection. Between now and that time, we should all follow those same guidelines and continue to social distance and wear a mask, and follow the wash your hands, follow the public health guidance. So even as we're doing this very aggressive campaign, we've got to continue to remember to do that. And as we learn more about the vaccine and how it prevents disease, we've got to continue to do that, because there may be still more things to learn about whether it prevents asymptomatic cases. What it prevented were symptomatic cases and serious cases in hospitalization, so the worst possible complications of COVID. And we're still learning more about that. But it's just, I think, very important to remember, particularly now with the holidays and New Year's here, that we don't want to see another spike after the holidays, and so continue to follow those guidelines. One more thing about logistics. One of the other important things to bear in mind is that this is a 2-dose, not a 1-dose vaccine. Coming down the pike will be some 1-dose vaccines, perhaps as early as the spring, if not earlier, and that will make it probably significantly easier logistically to vaccinate, and particularly in areas without the kind of tracking mechanisms that we have. And so that we are monitoring to ensure that we know exactly who gets which vaccine, because you can't mix the vaccines, and then call them back exactly either 3 or 4 weeks later, more or less, to ensure that they get vaccinated again. So this is all part of that logistical challenge that we talked about, but we have it automated in a way that we can order that vaccine and have them come in and automatically distributed to those providers at the right time.
Thanks, everyone.
Are we going to hear by any chance from one of the providers getting the vaccine?